Let's be real, sex as you get older isn't the same as it was in your 20s. But guess what? That doesn't mean it's not enjoyable anymore. Forget the myths. Sex isn't just for the young. In fact, many seniors continue to enjoy fulfilling intimacy well into their 80s. A healthy sex life isn't just about pleasure. It's also great for your overall well-being. It boosts your self-esteem, keeps you connected to your partner, and even benefits your physical health. So it's worth nurturing, no matter your age. What changes for men as they age? As time goes on, your body and lifestyle naturally evolve. Sometimes these changes might make you feel a little vulnerable or even uncomfortable, especially when it comes to sex. Let's break down some of the common changes you might notice. Lower sex drive. You might not feel in the mood as often, and that's completely normal. Discomfort or pain. Physical intimacy may not feel as effortless as before. Erection changes. You might experience erectile dysfunction or find it takes more effort to achieve and maintain an erection. Ejaculation changes. This could mean reaching climax too quickly or taking longer than usual. Physical changes. Your body, hair, and even your genitals might look or feel different. You may also notice less strength or stamina. Fertility decline. Lower fertility is a natural part of aging. Feeling fragile or tired, fatigue might make you less interested in physical intimacy. Emotional factors, stress, sadness, or anxiety can impact your desire and performance. Partner changes. Your partner's ability or interest in sex might shift too, which can add complexity. Feeling worried about these changes? That's okay. It's a common reaction. But here's the thing. These changes don't mean the end of your sex life. It's all about working with your body, not against it. You might need to switch up your routine a bit. For example, spend more time on foreplay and explore new ways to stimulate arousal. Be patient with yourself and your partner. It's about connection, not perfection. Communicate openly about what feels good and what doesn't. Aging doesn't mean you have to stop enjoying intimacy. It's just a new phase where you can discover different ways to connect and find joy. Remember, sex is still for you at any age. Let's talk about how your overall health ties into your sexual well-being. It's no secret that as we age, our bodies go through changes, and sometimes health conditions or medications can have an impact on your sex life. But here's the good news. Challenges don't mean the end of intimacy. They're just an invitation to adapt and explore new ways to connect. How health can affect your sexual well-being. Here's what you might notice. Medications. Certain drugs, like blood pressure meds, antidepressants, antihistamines, or acid blockers, can affect sexual function. Body changes, things like lower testosterone levels, sperm changes, nerve damage, or muscle and bone loss can influence how you feel sexually. Even low iron levels might leave you feeling fatigued. Health conditions, issues like heart disease, diabetes, cancer, or prostate problems can also play a role in your sexual health. It's completely normal to feel a bit frustrated or concerned, but remember, there are ways to work through these challenges. Adapting to your new normal. Here's where creativity and communication come into play. You and your partner can discover what works best for you. Let's take a look at some common scenarios. Post-surgery or illness. If you're recovering from something like a heart attack, it's okay to feel unsure about resuming intimacy. Talk to your doctor. They can help you understand what's safe and suggest ways to ease back into it. Arthritis or joint pain. If pain is holding you back, try experimenting with different positions or use heat therapy before or after to reduce discomfort. A warm bath or heating pad can make a big difference. Fatigue or low energy. Sometimes timing is everything. Plan intimate moments for when you feel your best, like after a nap or when you're less fatigued. The key here is to stay positive and focus on intimacy in a way that works for you. Intimacy doesn't always have to mean intercourse. It's about closeness, touch, and connection. Communicate openly with your partner about what feels good and what doesn't. Be patient with yourself as you navigate these changes. Aging and health challenges might shift how you experience sex, but they don't have to stop you from enjoying it. It's all about adapting, finding what works for you, and embracing intimacy in new and meaningful ways. You've got this. Let's take a moment to talk about how emotions can affect your sex life. It's true at any age, but as we get older, emotional factors can play an even bigger role. The good news? For many older couples, this stage of life can actually improve intimacy, but for others, emotional challenges like stress or depression might make things a little tougher. The upside: fewer distractions, more connection. For some couples, the golden years bring a golden opportunity for better intimacy. Here's why: more time and privacy. Without the chaos of work schedules, raising kids, or other responsibilities, you might find you have more energy and focus for your partner. No pregnancy worries. This can bring a sense of freedom and relaxation to your sex life. Deeper connection. With years of shared experiences, many couples feel a stronger bond, which can lead to more meaningful intimacy. The challenges, stress, and emotional hurdles. Of course, it's not always smooth sailing. Emotional stressors can sneak in and affect your desire for intimacy. Health problems. Chronic illnesses or recovery from medical issues can take a toll on your mood and self-confidence. Financial worries, concerns about money, or lifestyle changes might create tension in your relationship. Depression, this is a big one. Feeling low or detached can significantly reduce your interest in sex. If you're feeling overwhelmed, know that help is available. Depression, for instance, isn't something you have to face alone. Reach out to your healthcare provider or a counselor. They can. What you can do: open communication. Talk to your partner about how you're feeling. Sharing your worries or struggles can help you both feel more connected and supported. Seek professional help. If you're experiencing depression or anxiety, don't hesitate to get support from a counselor or therapist. Sometimes just talking it out can make a world of difference. Focus on emotional intimacy. If physical intimacy feels difficult, lean into emotional closeness. Holding hands, sharing a quiet moment, or simply being present with each other. Your emotions are a big part of your sexual well-being. But the good news is, with a little effort and support, you can navigate the ups and downs. Whether you're embracing newfound freedom or working through challenges, intimacy is still within reach. Emotionally, physically, and in ways that matter most to you. Seniors' sex tips. Keeping the spark alive. Let's face it, sex and intimacy might not feel the same as they did when you were younger, but that doesn't mean they can't still be rewarding. In fact, with a little effort and a positive mindset, your sex life can remain a meaningful and joyful part of your life. Here are some practical, real-life tips to keep things enjoyable and healthy. Sex tips: keeping the spark alive. 1. Talk openly with your partner. Communication is key. Even if, talking about sex feels awkward, sharing your needs, worries, or desires can bring you closer together. It's okay to feel vulnerable. Your partner likely feels the same way. If it's hard to talk alone, consider speaking with a therapist who can guide the conversation. 2. Take care of your health. Regular visits to your healthcare provider are essential. They can help you manage long-term conditions or medications that might be affecting your sexual health. If you're dealing with erection problems, don't ignore them. They could be a sign of something bigger, like heart health issues. Speak up and get advice. Avoid smoking, excessive alcohol, or other substances that might harm your sexual well-being. 3. Expand your definition of intimacy. Sex isn't just about intercourse. Touching, kissing, and other forms of closeness can be just as fulfilling. Be open to new ways of connecting romantically. Sometimes a little creativity goes a long way. 4. Change things up. A simple change in routine can make a big difference. If nighttime feels too exhausting, try being intimate in the morning when energy levels are higher and testosterone levels peak. Take your time with romance. Longer foreplay, new positions, or a fresh approach to intimacy can bring back excitement. 5. Bond in new ways. If physical intimacy feels overwhelming, focus on building emotional closeness. Try new activities together, laugh, and enjoy each other's company. Sharing new experiences can improve your mood, increase activity levels, and even boost your libido. 6. Protect your health. If you're starting a new relationship, remember that sexually transmitted infections, STIs, are still a risk at any age. Use protection like condoms to stay safe. Don't let romance slip away, even if you're single. Socializing and forming connections can lead to meaningful relationships and intimacy. 7. Stay healthy and positive. A healthy lifestyle directly impacts your sexual health. Here's what to focus on. Eat well. A balanced diet supports your energy and overall well-being. Exercise. Stay active to maintain stamina and strength. Limit alcohol. Too much can interfere with performance and desire. Don't smoke. Smoking affects blood flow, which is essential for sexual function. Think positive. Practice gratitude and focus on the joys in your life. Stay hydrated and get enough sleep. These small habits can have a big impact. 8. Make time for what matters. Prioritize loved ones, hobbies, and activities that bring you joy. A fulfilling life outside the bedroom can lead to greater satisfaction inside it. Regular checkups with your healthcare provider can keep your health and your sex life on track. Your sex life doesn't end as you age. It evolves. With open communication, a healthy lifestyle, and a willingness to adapt, you can continue to enjoy intimacy in ways that suit your current needs and abilities. Remember, it's never too late to reconnect, explore, and keep the spark alive. Life is a journey filled with lessons, challenges, and growth. As we navigate relationships and self-discovery, remember to stay authentic. Embrace your unique path and live unapologetically. The insights we share here are meant to inspire and empower you to lead a more fulfilled life. If this message resonates with you, don't forget to like, share, and subscribe to our channel. Hit the notification bell so you never miss out on content that helps you grow, reflect, and thrive. Let's continue this journey together. Your next step towards personal growth could be just one video away.